All right, you guys, welcome to another day of the Interstitial Cystitis Walk. We have a really special few guests here today. First of all, for those of you guys who don't know me, my name is Dr. Nicole Cozine. I'm the author of the Interstitial Cystitis Solution, founder of a clinic called Pelvic Sanity in Orange County, California, a pelvic health physical therapist, and ICA board member, and my clinic's hosting this walk this week. And I have really special guests here for you guys today. This is Dr. Laura Lamb. Laura, why don't you go ahead and wave? We have Sarah Bartoloni back there, and we also have wonderful research assistant Eli Ward. And these people are working hard for you to study interstitial cystitis. They are Beaumont Health. Yeah, you guys, welcome so much.
Thank you so much for the opportunity to be here. We're really excited about this upcoming opportunity and thrilled to be able to help IC patients.
Cool. So we're going to ask a couple of questions, and then we're going to go over how you guys can participate in their research. So Dr. Laura, so as it stands right now, there really is no true diagnostic test for interstitial cystitis. Right now, IC stands as what we call a diagnosis of exclusion, right? Meaning that you have to, there's no one thing that can be like, oh, you have IC. Instead, it has to be like, you don't have all these other things. Therefore, with the symptoms, you have to have IC. So how is this study different than what has been done before?
Yes, that's a wonderful question. So before, and traditionally as scientists in the lab, we try to look for subtle differences in patients' samples, whether it's urine or blood or some other sample type. And those differences between IC patients and somebody that has maybe another bladder disorder like overactive bladder or normal healthy bladder has been very subtle. So we couldn't really say, you know, a home run, this is different from this person.
Right.
But
okay.
with advances in technology, we can now use artificial intelligence and machine learning to take those very subtle differences and make them very big. And so that's why now, at this time, at this moment in research, we can now identify this person has interstitial cystitis and this person does not.
Yeah, that's so awesome. It's so cool to be able to like revisit something that wasn't maybe working in the past, but like gut check feeling wise, like we know has to be there, right? And then being able to discern between people. So this is so great. I think that, you know, there's a huge misconception, you know, if I'm looking at social media and some of a lot of people that have IC, I think I hear quite a bit that, you know, no research is being done, people don't care about this condition, and you guys are just like a prime example of how that is so false. And then we're busting that myth today, right? Because there's people like you guys that are dedicating your careers to finding out how better to help people with interstitial cystitis.
Absolutely. You can see we have a huge lab behind us, and we have many talented team members, some here and some that are not, that are working really hard on interstitial cystitis, trying to not only develop diagnostic tests, but hopefully one day develop better therapies and interventions for it. Part of the reason we don't have better therapies and interventions for IC is because we haven't had a simple test for it before. And so this should make it easier, if we're successful, for those type of clinical trials to come along.
Yeah. And I think too, you know, your point's so well taken that we need to like know who has the condition and hopefully who has the condition earlier, right? Because the average onset of diagnosis is what, I think 7 years or something like that, crazy, 5 to 7 years. It's something nuts.
Yes.
And so it's like, I think that this would be so cool that if this does turn out to actually be able to differentiate between people, that we can actually have a diagnostic test that will help people earlier get a diagnosis, and then therefore can start the journey of treatment a lot sooner as well.
Yes, absolutely. We don't want people going 7, 10 years without having a diagnosis. We want to take that time down to a few days, and then they can get on a management plan for their symptoms.
Awesome. So, okay, so research is super expensive. So how are you guys funded? Because I think this is an important thing to talk about.
Yeah, so we're very fortunate to be funded through the Department of Defense, or DoD. So the DoD actually supports a whole range of research from not only interstitial cystitis, but also breast cancer and different types of neurological diseases and so forth. And so one of the reasons the DoD supports IC research is because of the ICA. And so because of the work the ICA did, the DoD knows that this is an important disease that needs new solutions, and so that's why they're supporting research. So thank you to the ICA for really promoting and making sure that that not only the DoD but also the NIH and other federal institutions know that this is an important disease.
Yeah, and I think that many people might not know, when the ICA board has an ICA Advocacy Day where we have a board meeting and then we go on Capitol Hill and we split up, and it's a big team of us, and we split up and we actually go and specifically ask for, and this is a line item out of NIH funding through the Department of Defense, and every year it's like free for all again. So the interstitial cystitis diagnosis goes off the list along with many others, and we have to specifically ask for it to be on that list again so that it can have a special carve out of NIH funded money. So it's really exciting that especially because of the ICA's efforts, your guys' funding is there and present and working hard to maybe find a nice diagnostic test. Okay, so now real question is, how can people actually participate in this amazing study?
So all you need is a device that allows you to get it online. So whether that's your phone or computer, you want to go to the website www.icstudy.org.
Perfect.
And there we'll have all the information on how to participate in the study. There's videos on how to collect your sample, how to ship them. And there's also a short survey for you to fill out to see if you can participate in the study. So we're super excited for the study to launch, and please visit the website.
Cool. So I did, and I got my own kit here, right? So Dr. Laura, there are 3 things in here. So we need to talk a little bit about who can participate. So the 3 things that are in here are obviously all the paperwork that you had, and then there's 3. This is a female control, right? So this is one that I would use because I don't have interstitial cystitis. So I would go ahead and give a urine sample in this, fill out the form, and send it your way. Lucky you guys. There's also there's also the one in here that is labeled IC. So if you've been diagnosed with interstitial cystitis from a physician, is this correct? That you would go in here. What about males with IC symptoms or chronic prostatitis diagnoses?
Yeah, so we want to collect the full spectrum of the IC experience. So we are asking that you have an IC diagnosis.
Okay.
If you are in one of these categories, that's maybe just make sure that when you fill out that survey and there's a free response section, just say that you have been diagnosed with maybe chronic prostatitis. We are very, very interested in having males, females, 88-year-olds, 20-year-olds. We want everybody represented. If you're pregnant, you can still participate. One of the other things is English does not have to be your primary language. We have a Spanish form and version of this test available. So we would love for people with Hunner's lesions, not Hunner's lesions, to participate. We're also going to do another little ask. We need to have samples from people that don't have IC. So thank you for you sending in your sample.
Yeah.
But when we send you your kit, as you saw, there were several different boxes in there. So if you have a family member, a friend, a neighbor, coworker, somebody that cares about you and IC, and you feel comfortable asking, we would ask you to provide them with that kit. And they don't need to give it back to you. We'll give you all the shipping materials as well.
Perfect.
We want to make it like not weird. But if you could ask them if they would be interested in supporting IC research and participating in this study. We're not going to collect any information from them. They just have to provide the sample, fill out the survey to make sure that they're, they fall into a normal category, and send it back to us. That will be so, so helpful, and it will really help when we go to the FDA to get approval for this test, show that, yes, this can tell people that have IC versus people that don't have IC. So
right. And in research, and in research language, that's really, really, really important to have the control group of people that don't have it, and then also the people that do. So this study will not work unless we have both groups of people participating. Is that correct?
Correct. And we need lots of people to participate.
Lots of samples.
The more the better. Share it with your friends, share it with your family, share it with other people that have interstitial cystitis and maybe don't have access to the ICA. So the more samples we get, the more sensitive and reliable this test will be. You're making it a better test. So please, please participate and try to get all your friends and family to participate as well.
Awesome. Okay, you guys, do you have any other like little pearls of wisdom or any other asks for the community here today?
I know for some patients, it's difficult to make a lot of urine at one point.
Ooh, good point.
Yeah, we don't need a whole lot. So if you are only able to produce a little bit, we will take it. We want it. So again, the more we get in terms of number of samples, the better the test will be. And ultimately, you're going to be helping IC research, especially for future patients.
That is awesome. Okay, one of the walk challenges today is to request your sample. So when you actually do that, you're going to use the hashtag walk the number 4 IC 2020, and you're also going to tag Beaumont Health on social media, and that is how you can enter to win a prize. So that's going to be exciting as well. So hopefully you guys will be trending on social media here. Right? So you guys, thank you so much for your dedication to people with interstitial cystitis. Thank you so much for caring about early diagnosis and finding an easy, simple diagnostic test. Good luck. We need everybody's support and everybody's help.
Thank you so much, and good luck with the walk. We're very excited for you guys.
Thanks. All right. Thanks so much, you guys. I'll talk to you later.
Thank you.
Bye.
Bye.